Deliver is an advocacy organization. We change hearts and minds and drive investments in gender equality and women's health and rights. We started working on maternal health, as we say, women deliver, and so much more than babies. So today we have a broader portfolio and we work on the whole gender equality, but we know that health is foundational for progress and prosperities for people and societies.
Right. I think it's a fascinating initiative, advocating for investment in gender equality, health. Now, why is this issue worth your efforts? Of all the pressing issues that have been talked about in the conference, do you think it's worrying? Is it worrying enough for you to invest in it, your energy, your, everything?
For any society in the world, not least on the continent, health is wealth. Health is a foundation for prosperity, for well-being, for a family, for community, for a nation. Women and girls, and particularly women, are often the ones who control health of a family, and so a health system and a universal health coverage, as we discuss a lot in this conference, need to put girls and women front and center. Their health, their well-being define the health and well-being of societies.
Right. Now, I understand you are working across the world, but let's focus on Africa. Africa is one of it's a place with like the most difficult health issues in the world. Now, talk to us about your work on the continent. What impact are you having here?
So we work with a lot of different organizations, entities, government, young people to look at health systems and the determinants that affects a health system and really try to drive investments. If we look at the indicators, we can see maternal mortality is still a big issue in Africa, in many different countries. Access to contraception, modern contraception, access to health services, and not just in the capitals, but also in the rural areas, they're really big issues. And if families are not healthy, what about the education? What about the work? What about, kind of the economics? That is so foundational. So the way we work is we collect a lot of evidence, a lot of data, and a lot of solutions. And then we work with organizations across the continent on some of those solutions through campaigns, through advocacy, and through both governments and very much civil society.
Right. We were yesterday having a conversation about health financing on the continent, which is quite weak. There's shortage of funds for health services on the continent, and statistics indicate that budget of financing for health averages only 8% on the continent. Now, let's talk about this particular issue of gender equality, health, sexual reproductive health. Mm-hmm. Why should governments be, more willing to allocate more funds in this particular area?
There are very strong investment cases for why it pays off to invest in both gender equality, but also the health of girls and women. There are strong ripple effects. So when we look at financing for health, it is so important to have that gender lens included. We know that if there were gender equality in the workplace in the world, then we could add 26% to global GDP. And when we break down on country, in most countries it's more than double digits, and that's a lot of growth. And health is foundational for that. So that part of gender equality is so important. We know that if a mother dies in childbirth, or her family and her children fare worse, But we also know from some of the big research that if the mother is healthy, if the mother is educated, that's some of the things that really can propel progress, and not just for the individual. So when it comes to the financing part, looking at, for example, what has been done in Rwanda, by setting targets, setting KPIs, measuring progress, and holding government and regional governmental entities and health systems accountable. That's what works.
You told me that most of your services are accessed via the internet, online, and we know that internet penetration of the continent in Africa is very low, and this continent will probably be the most, it's the one that needs most your services. Now, what can you do sure your services are easily accessible?
So we're an advocacy organization. We don't provide services. We don't build clinics. We don't, sell products. But what we do is we train advocates and organizations across the globe. So we have a digital university and a young leaders program where we now have more than 700 young leaders, more than half in the continent of Africa. They get trained in advocacy, whether it's through mobile, because of course our platforms are diverse, so it's not just the internet, it's also on mobile, and that has a much bigger penetration here than almost anywhere in the world. So kind of training people with the right data, with the right skills, with the right competencies to be strong advocates, to know how do you read a budget, how do you affect a budget, how do you kick the door into the ministers and really kind of build coalitions that can make sure that the needs of people, the needs of girls, the needs of women are heard and taken into consideration. When you invest in girls and women, when you invest in their health and their rights, there is a strong, strong ripple effect that affects everybody, and everybody wins. If we want to see better health, more wealth on the continent of Africa, we need to invest in girls and women. It's everybody's business, but it cannot be business as usual.